with psychedelics?
Yeah, I sold my clinic about a year ago.
Well, yeah,
I
you
had
were
25
multimodality, weren't
year
you?
old multidisciplinary clinic,
Yeah.
and I sold that. I also ran for mayor in my community. The integration of healthcare policy and data was really important to me. So basically, encompassing all of healthcare means access to medicine, access to compounds that make my patients feel better, and access to data so communities can make evidence-informed decisions on preventative healthcare. So when you have the data that tells you that your community has pockets of asthma or pockets of diabetes, you can generally look to land use and go, oh, look at, there's a little pocket of drive-through fast food in that area, and there's an increased incidence of diabetes. So all of these things can be accessed by city planners in order to create land use decisions. Well, the same was true for cannabis policy and psychedelics policy. We've legalized cannabis in Canada, but we lost the economic development faction of it by basically shutting down all the community-based economic development in order to have the legal world come in, which was a lot of high-powered, a lot of stock market companies. And I think Australia had the same. And
Yeah.
psychedelics are the same. It's access to medicine. You know, there's so mental health, especially during COVID, we see that healthcare research can pivot so quickly. You were mentioning earlier before we got on here about the vaccine trials, which I find fascinating.
I know, we're very, very excited. And Queensland, it's funny, we seem to have a really successful research branch in Queensland for some reason. So they've been, obviously this is front and foremost trying to get a vaccination to get everybody up and running. And last week or the week before, I think it was last week, they just started talking about the start of trials on a new vaccination for COVID-19.